Yeah, this is great. Soothing.
Alright, so this one, like I say, you're just gonna, I just have them rotate right there, and just watching. She's freaking out. Okay. That's vertebral basilar insufficiency. Cervical flexion rotation test is basically what we did for AA. So it's a great test for headaches. So if they have a decrease side to side of more than 10 degrees, it's considered a positive test. So same thing, it's just an your AA rotation test that we did yesterday. So just bring them up. She's got a lot of mobility there. A little limitation there. So she's got a little bit of deficiency going to the right. The main thing with this test is keep their head up and don't drop their head as you rotate. Do that. They'll fully get past there. No limitation going right.
What was it positive test?
10 degrees difference from side to side. They have 10 degrees or more less rotation. And typically a history of headaches in this is where you're going to really use this.
So are you looking for any sort of reproduction symptoms at all?
Just looking for diminished motion primarily. So people that have cervigenic headache, postural headaches, those type of things, not your migraines. Headache, people who sit in class for 2 hours and get a headache, and it's not from listening to the professor.
That's a secondary. It's not
Secondary,
primary.
not the primary problem.
Secondary to the, that's your secondary to the.
All right.
Part of the problem.
So neck flexor muscle endurance test. So we have deep neck flexor test and cranial cervical flexion test. There's some people use them interchangeably. The first one I tell people to do is just tuck your chin. Yeah. Give yourself a double chin and hold it for 10 seconds and relax. So looking for that. You should not see the sternocleidomastoids come in. It should be using the deep neck flexors and not the SCM. So watch that, those will protrude out. So they can do that pretty well. Come in, put my hand just underneath there. Okay, hold that right there. Hold that chin tuck. So you're gonna watch the folds of her neck. Okay. Everybody take a bathroom break and we'll come back. So you should not see those folds change. Norm for most people, for the research, was 38 seconds.
Oh.
So
You're supposed to be able to hold a double chin for at least 38 seconds.
without your SCM,
Right?
without your SCMs kicking in, yes. I said that was the research study.
Okay.
Now, you got to go back and look at that study and see who was doing this test. Was it people who are fairly young and things? Because I've done this on pretty much every neck patient, and good's about 25 to 30 seconds. Most of your neck pain patients, 5 to 10 seconds. So this is testing your longest coli, all those deep neck flexors we saw on the cadavers. So you know how small those muscles were, anterior to the vertebrae. So try to test this on each other. People who have headaches typically have deep neck flexor weakness, whiplash. Just anybody's had particularly any trauma, like a concussion. Patients will have diminished deep neck flexors because of the trauma. So those are the people you'd look at with that test. So try it one more time. We'll try to keep from laughing next time. So hand underneath, about a 1 inch off the table is really all you're trying to get. Tuck the chin. Let's see how.
Kelly, are you holding your head up?
Mm-hmm.
Yep, her head's off the table.
For those of you that are getting a lateral view, she's kind of struggling, but those SCMs are firing pretty hard.
Yeah, they're starting to come in. Starting to lose their.
You stop counting once SEM start.
They really obviously kick in. Tuck the chin a little more. There you go.
Okay.
Okay, stop.
I told you that was
20, 25 seconds is, I see